Joining us now, Dr. Jennifer Bryan is in the Element Well studios, currently a family physician, chairman of the Mississippi Delegation to the American Medical Association, and District 4 trustee, immediate past chairman of the board of the Mississippi State Medical Association. So I know you've been busy, and you were chair of the board, you told me 3 years, right?
Yeah.
Mississippi State Medical Association?
Yeah, thanks for having me back.
Yeah, good to see you and good to have you in. So we wanted to start by getting the rundown on the conflict that seems to be lagging. That conflict is between Blue Cross Blue Shield of Mississippi and the University of Mississippi Medical Center. They still hadn't done a deal yet, right?
They haven't. It's incredible how long it's dragged on. Of course, we've been here before. We've watched it go. And still hopeful, that Blue Cross is going to work things out to readmit UMC to the network so that the patients can regain access to care.
This may be a rhetorical question, but what's the central issue in the dispute here?
So, I don't work there, right? So I've talked to a lot of people over there at UMC, and I think they have some good points. But bigger than that, we continue to have a problem with Blue Cross Blue Shield, and it's not a good relationship in general with physicians and many hospitals. And if you look back decades, this has gone on. So this is not new. At the core of it, if you just look on a very simplistic level, it's about negotiations of money, right? That's what it boils down to. But at the end of this, it's patient care, and that's what we are most interested in at the Medical Association. Is patients are going without care, and why is that? A lot of people see a monopoly effect going on. And when you look back on the history of Blue Cross and their business here in this state, and then other Blues across the country, this is similar. And the pattern is when you have an entity with such a large market share in a monopoly of any kind, there is no drive to just have the highest quality when the bottom line is money. Mm-hmm. And I know a lot of folks are interested in more competition, free market competition, and would like to see avenues for that, because when we compete, patient quality and care improves.
Yeah, throughout the entire ecosystem, not just in the realm of insurance and the coverage, but also in the delivery of medical services as well. The same applies.
Well, and this is so complex. It honestly, years of me watching this and reading, and still there's so much more to learn and know. But yes, it is how we got to this situation we could talk about for days. But the fact is there is a monopoly effect, and patients are losing access to care, to appropriate medications, and physicians and other providers are being stifled in the ability to provide quality medical care.
So let's clarify, though, Dr. Bryan. Mm-hmm. A patient or a would-be patient or a person in general that is a subscriber, is insured by Blue Cross Blue Shield, has coverage, pays premiums. Maybe it's them and their employer. It just depends on which group, if they're in group or individual coverage, right. Or in general, those are the two main types. But all right, so UMC is not in network. It doesn't mean that their services, should they be treated and receive services from UMC, aren't covered by their insurance. It just means that they may have to pay for it right then.
Right.
They're going to get billed for it. They
right.
then file that, and they then wait for their money. And sometimes those are big bills, and people just don't have the money to do it. I'm being told anecdotally by friends, they're having to go to like Birmingham and other cities. Is this happening?
New Orleans and Memphis, right. And so part of the network adequacy situation is, these guys, they need each other.
Yeah.
At the end, Blue Cross has to have to show that to their members,
right.
That they can provide adequate and reasonable access to services.
Right.
I'd put forth that Birmingham is not reasonable access, okay? Similarly, with Blue Cross Blue Shield owning the largest share of the market, Blue Cross Blue Shield, UMC, needs a good working relationship with them. And
sure.
So there's a standoff. But from, the Medical Association put out a statement last week. This is not just UMC that we are concerned about. We are concerned about the impact on the state of Mississippi, the patients. We are seeing it. I don't know how many doctors have reached out to me over the past couple of weeks and to my colleagues in leadership thanking us for speaking up. It's a very difficult needle to thread.
It is. And so obviously there are a lot of other providers, hospitals, clinics, individual providers, et cetera, that are also in the Blue Cross Blue Shield network. But let's talk about UMC, the hospital proper, and general hospital services. Mm-hmm. There are others that are in their network. Are they reimbursing the same?
So, again, a lot of these things are sealed while they're in mediation, and I don't work there, right?
There's contracts between the insurer and the clinic.
But and so, we can go back and forth about other academic centers getting paid at higher rates.
Okay.
We can talk about, why UMC may, as an academic medical center that trains physicians and students, have a different reimbursement rate when they have a liver transplant, a kidney transplant program, these organ transplant, these high level of care.
Yeah.
All of those things are outside. I mean,
you can't get anywhere else.
You can't, right? You can't without driving 3 hours. And again, I mean, how much does it cost to fill up your tank right now to drive to Birmingham? Sometimes that's just out of the possibility for the average family.
And then there's just the time delay in receiving the care. And then the bigger issue is you just don't do it.
Right.
I mean, that's a concern that we all should have.
Well,
right?
and UMC is a huge concern, but I look at it as an opportunity to have a conversation.
Okay.
The biggest conversation that I want to have is that we have a market that is not conducive to competition.
Yeah.
And that is look at our health outcomes, 50th across on so many different things. Anything we can do to improve quality, we want to do. When your bottom line is your major interest, and you own a market share the way Blue Cross does, it many times gets sideways with our physician practices and what our goals are to give the patients the best care.
Yeah, and of course, I think the thing that's a lot of folks maybe don't understand is that insurance is regulated at the state level, and so it's not that other insurers and carriers can't come into the state and set up shop. But it's difficult to do, and it's difficult to build that network.
Well, and again, like in a radio segment, it's hard to get into the details, but I'll say that Commissioner Cheney has been, a champion for patients, and I think that there's an ability for him to possibly be empowered to enforce some things that need to be enforced. Market conditions, over the next 5 years, this is a long game, the way I look at it. UMC's got their short-term battle, and we're watching it with interest, and hope that Blue Cross will work to getting them back into network. Yeah. But long-term, our state can do things to make this environment attractive to other insurers to want to come here and to want to operate here.
That's precisely right. Because, you have a similar situation in Louisiana and Alabama with the Blue Crosses and those. They're 90% of the coverage.
No doubt.
In those states. But they're not having the same problem.
So, they're having a problem, though.
Okay. Well, I'm just not aware of it then. All right. Well, thank you for pointing that out. But it's the same issue is that we got this state-level regulation, and it's such that it's almost impossible for somebody else. It's not economically feasible for them to come in, set up shop.
The way we are set up right now, the environment in Mississippi is such that they have their hands tied behind their back before they even get out of the gate.
No doubt about it. So they don't come.
Right. And so now the problem is UMC has their problem, and some of it is rooted in this, but doctors across the state, I would go on, I don't speak for them, but nurse practitioners and other providers do as well. Blue Cross is a behemoth to deal with, and we need help because the patients deserve better access to care.
I'm with you. Well, hopefully we will get a swift resolution that is in the best interest of all, and in particular the patients. But it breaks my heart. At one particular case I know is of a single mom and a child, and the child is being treated at UMC, and it's expensive. And has coverage with Blue Cross, but it has to go to Birmingham right now to get their child treated.
Well, that and don't even get me started on telemedicine and the problems that we had there during COVID. I mean, that was a very real problem.
Yeah, and I know, and okay. we could go on, and then I start thinking about the certificate of need situation and sort of the special exceptions there.
There's so much, but telemedicine is here to stay. You look at Sally Doty's work over there.
We got to expand it.
We've got to do it, and we need folks to be paid for the services so patients can get the care they need.
Dr. Jennifer Bryan in the Element Well Studios. We'll take a break and come right back. Thanks. On the C Spire text line, most all the doctors in Grenada are owned by UMMC. Well, I think that's because they bought a facility up there.
Yeah,
right?
they I don't know if they bought it or managed it, but that Grenada hospital up there is a UMC affiliate.
Does Blue Cross Blue Shield manage the state's insurance program? I believe it is a self-funded program, but it is administered by Blue Cross.
Right, and I think my understanding is it goes up for bid in 3 years again. So there's some time there to work some things out, hopefully.
Yeah. So. All right. You were telling me offline, though, Doctor, what are some of the other issues that we have just besides this general issue of coverage and in-network, out-of-network? At this point, UMC's not in-network. Doesn't mean that your services there aren't covered by Blue Cross if you have their insurance. It just means that they ain't going to file it for you. You got to pay. Before you walk out, in many cases, unless you make other arrangements. Sometimes they will do that. Most medical providers are very, I found, accommodating in that respect. Yes. Are they not? If you say, I can't pay it all today, but 6 months I can pay you in installments or something.
I could tell you wonderful stories of many hospital systems and doctors' clinics across the state that do that. Absolutely.
No doubt.
I mean, we want to help people.
Sure.
There's so much to cover, but we closed on the first segment on telemedicine.
Yeah.
I can tell you things about at the height of the pandemic when the government shuttered clinics. Right, we were trying to protect the workforce, and nobody could physically go into a clinic. We had to do telemedicine.
Yeah.
And we couldn't get reimbursed for our most common code from Blue Cross, though Medicare and Medicaid would. And when I asked their top leadership why, they said, I just don't think that you can do that level, right? They just disagree, and they can do that because of, again, the monopoly effect.
Yeah.
It's going to take members, the constituents across the state, I think, to speak up in this situation a lot, because these are difficult market forces to overcome,
Sure.
and we can go on and on about the things that are problems, like, for instance, medications. I mean, it's a big problem. If I want to prescribe you a medication, I've got to do a prior authorization process. That's just extremely onerous. Prior authorization is a major problem, and we've got several initiatives to deal with that. But again, the biggest problem is when you've got one elephant in the room, they can do whatever they want to do, and the patients are the ones who are hurting. The constituents are the ones who are hurting. So UMC's battle is theirs, but we are all watching it with interest because it affects everyone.
Yeah. But, it, too, is a regulated industry, highly regulated industry. It seems like maybe we'd have some teeth there, but, of course, a great deal of that has to come through statute, law.
Yeah, and I think we have, we alluded to a long-term game, so I think that some of our elected officials are beginning to have an appetite to have these conversations, and there's much gratitude from our side for that. We just appreciate listening ears. It's a problem.
Yeah.
And I think it's not just us. The patients come in, and it's every day. Like, I thought I had good insurance. And they are frustrated. They're very frustrated. And I don't know, I'm sure you know, but many people don't know that the shareholders of Blue Cross, who should, have input, long ago gave their power to a board of directors. So There is a board of directors making the majority of the decisions. And they can reclaim some of that, as my understanding, by writing a letter in and so on. But in reality, there's a small group of people making decisions. And when you are a corporation and your bottom line is your goal, these things are kind of common sense. And in other businesses, while it makes sense to cut quality sometimes on things, like maybe you want cheaper Tupperware in your kitchen or whatever it is, right? Your quality doesn't matter as much. When it's somebody's heart or somebody's stroke care or their cancer care or their liver transplant, it matters.
Well, and let's also point out, I think it's fair to do so, that in accordance with federal law, health insurers do have a limitation in that on their profit, and that 80% of their premiums have to be paid out in claims. Mm-hmm. Now, How that's calculated is another story, right? I mean, there's a lot of
statistics, right?
Right. And it's just a lot of machinations that go on behind the scenes to get to that. And there have been billions of dollars of rebates paid out by insurance companies directly to their subscribers, their insured customers. I want to say Anthem Blue Shield in California may be at the top of the list of the amount. Of course, they're a huge, provider, or a huge carrier, I should say. So it just seems like all this government, I mean, that's just kind of getting into the more the political aspect of it, but all this government ain't making this better. It's supposed to be making us better. It seems like it's making it worse.
I think there are some things that could probably be undone to allow more free market competition.
Agree.
And I think that, my understanding is that there's a lot of profit that has been made over the years, and I'm for that, but I'm not for patient care to be hindered. And again, telemedicine. When we look at that in the pandemic, we remember when the hospital halls were empty.
Sure.
Right? We remember when the clinics were empty. Premiums rolled into the insurance companies. They didn't go down.
That's right.
And they weren't paying it out.
That's right.
So, and looking forward, we need. Here's a tangent. Pay parity on telemedicine. We've got to reach these rural areas, and we need partners that are willing to step up and take care of these people with us.
And today it's telemedicine, but you know as well as I do, this is incredibly dynamic and ever-changing, and there are innovations coming out every single day, and they move way faster than the industry is, than the payment industry is, if you know what I'm saying there. And speaking of that, I think we as patients, we stay confused about who we owe and how much we owe. It's so dang complicated between the co-pays and the co-insurance and the maximums and the this and the that. You can't figure it out. It's really difficult.
It's quite complicated, and I think you see when you go back on this battle over the past few decades. I was reviewing on the break. I mean, there was a battle with North Mississippi Health Center and Blue Cross that went on for a while. They were out of network. Gulfport Memorial was a part of that. HMA, when they were operating here, now Merit, there were 10 hospitals involved there. Mm-hmm. So I hear a lot about why is this just UMMC? It's not. When you look back, this has been going on a long time. And about 25 years ago, there were 13 companies that were writing policies for different small businesses around the state. We're down to 2 now.
Yeah, we don't have any.
Blue Cross and United. And something feels wrong about that, right? I mean, we need competition.
Well, we need to think about, smart people need to get in a room and figure out how do we attract some other carriers to set up shop here in Mississippi and get the providers in network, because that's the key part of it.
Well, and I can't stress enough how important it is for policyholders to complain and to make noise. I mean, honestly, it's your health, and it matters. And these things are affecting the individual people. So, talk to your lawmakers, talk to the insurance commissioner, talk to the insurance company, send emails, talk about it. How is it affecting you and your family personally? These are the things that people need to know to affect the policy changes that need to happen.
Yeah, that's good. That's good advice, and I agree with you. And I think that if these lawmakers start hearing more from the folks that vote to keep them in office or put them in office, they'll respond. They'll respond to that.
Well, I agree. And I'm telling you, there's some lawmakers that are listening, and I appreciate that, because at the end of the day, we've got to do right by our people. And right now, their medical care quality is hurting by a lack of access. And that's something that can be fixed. And I think it can be fixed over the next few years if we put our minds to it, like you said, and just get together and figure it out.
Well, when I hear these stories of people driving out of state, and then I start thinking about, well, how many are not able to do that, thus they're skipping the care or just not receiving it?
I see them every day.
Oh, man.
It is sad. It is very sad. And also, I need to find a new doctor because mine's not in network.
Right.
Well, disrupting that relationship, that's a big deal.
Big deal.
The doctor's known you 15 years, and now you just got to start over.
Big deal.
It's a problem.
Yeah, it's a big deal, and it's incredibly stressful, uncomfortable for the patients to have to go through that. Well, we got to do something, and I know folks are listening that have the authority to do so. And it sounds to me like we need to assemble at the table a variety of brains that really represent the entire ecosystem here. This is a complicated matter. It's obviously it's clinical, it's business, it's economics, it's legal, it's state policy. It's complicated.
Well, yeah, it's a lot. And so I'm bringing a bigger message, which is I'm for the patients every day of the week. And I'm here on behalf of the patients, and we need some help taking care of these guys.
I agree and appreciate that. Appreciate you coming in, Doctor. It was very informative. Lots of great feedback on the text line as well. I'm sure we'll talk soon.
Thank you for having me.
Dr. Jennifer Bryan has been our guest here on Middays. We're in the Element Well studios. We'll come right back.